Hello everyone and welcome to Health Elite. Unfortunately, in its early stages, cancer is hardly noticeable or manifests only very subtly. However, there are certain signs that should make you sit up and take notice. If these occur suddenly and frequently, you should be examined by a doctor. Please note that all these signs do not necessarily mean cancer. They can also be harmless or originate from other illnesses.
Long-lasting bloating. Women, in particular, are naturally prone to bloating. Their digestive system reacts more sensitively than that of men. Bloating from a typical or heavy meal of cabbage, legumes, fatty meat, or cheese is completely normal. If, however, the bloating persists intensely over a period of 2 to several weeks, caution is advised. First, those affected should be able to rule out other sources of the disturbance. Stress and lack of sleep can also contribute, but if they occur in combination with other early signals, you should not wait to visit the doctor. Constant bloating can be a sign of breast, colon, gastrointestinal, ovarian, pancreatic, or even cervical cancer. The doctor will first perform some blood tests. Other medical testing procedures include ultrasound images, mammography, colonoscopies, and a CT scan.
Unusual skin changes, small wounds on the skin that heal poorly, as well as dark or particularly light discolorations, can certainly provide an indication of cancer. If moles change, this can initially be completely harmless. The straighter and more even a change is, the lower the risk of an illness being present. On the other hand, if moles look irregular, turn reddish, bleed, or form small growths, you should seek medical attention immediately. Unfortunately, we cannot fully see our own bodies. To check your skin from time to time, you can use a large mirror. Alternatively, your partner or a good friend can examine your back or other inaccessible areas for changes. There is a particular risk for people who have a large number of moles, have very fair skin, are prone to sunburns, or have had them frequently. This also applies to those whose skin is extremely tanned in summer or who use tanning beds a lot. Incidentally, most health insurance companies cover the costs of an annual checkup starting at age 35. During this, a dermatologist examines all existing moles with a special lens for any tendency toward malignant changes.
3. Changes in the female breast. Women should examine their breasts regularly themselves. Experts advise a gentle test, stroking, light kneading, and pressing. If nodules or hardening appear, a specialist must examine this immediately. By no means are all nodules malignant growths. Growths in the fatty tissue or calcification of the gland within the breast can be completely harmless. Other changes that should be well investigated are nipples suddenly pulling inward, unusual wrinkling, dimples, or pitting on the breast, scaling and extremely dry skin around the nipples, redness or inflammation of the skin, as well as unpleasant tension or extreme sensitivity to pressure. In addition to the breast, you should also examine and assess the surrounding tissue up into the armpit. The ritual of breast examination can be easily integrated into daily personal care. When you have finished showering and are applying lotion, you can do the breast check at the same time.
Blood in stool or urine. Unfortunately, in very few cases do people turn around after using the toilet to look at the contents of the bowl. The tabooing of one's own feces is still common in our society. Nevertheless, you should look every now and then, especially if you already feel unwell due to other symptoms. Blood in the stool can be difficult to see with the naked eye. If blood is present, it is high time for the doctor. Bloody stool can come from hemorrhoids or be a symptom of colon cancer. With urine, it is a bit easier. Here, a slight reddish discoloration is noticed more quickly. Men in particular notice these warning signs quite quickly. Bloody urine can have various causes. Besides other possible disturbances in the bladder or kidneys, it is the first sign of bladder or kidney cancer. If you bleed from any other body opening, or if an open sore has formed on your body, you should also see a doctor immediately.
5. Changes in the lymph glands. The medically correct term is lymph nodes. These 5 to 10 millimeter nodes are round or even oval-shaped. Humans have between 300 and 700 of them. They are responsible for filtering tissue fluid. Lymph nodes are an important part of the immune system and are distributed throughout the body. You have likely felt your lymph nodes in your head during an infection. Among the best known are the lower jaw lymph nodes. With a high fever, these glands, arranged in pairs, can be significantly swollen. Other lymph nodes are located behind or below the ear, at the back of the head, and at the chin. If you notice a small, round hardening or swelling anywhere on your body, this could also be a swollen lymph node. The reasons for this can be varied. If the swelling persists for more than a month and you can find no other explanation for it, then you should see a doctor.
Swallowing problems. Occasional problems with swallowing are not unusual at first. Harmless causes include a dry throat, swollen tonsils, a sore throat, or an inflamed nerve in the neck. However, if the symptoms persist for an unusually long time and are accompanied by vomiting or weight loss, this is a very serious warning signal. It can indicate throat or stomach cancer. For a detailed examination, the doctor will perform an endoscopy. This involves inserting a tube with a mini camera into the throat and pharynx. Other methods for clarification include a CT scan of your neck, chest, and abdominal cavity. A large part of the population is happy about weight loss and may even be on a diet. If these efforts bear fruit and the pounds drop, everything is fine. If, however, you suddenly lose 5 kilos or more without having done anything for it, this could signal a real problem. Sudden weight loss can be caused by stress or thyroid disorders. Sudden changes in life circumstances can also be a reason. If you notice these signals, you should think carefully about possible causes. Among the less pleasant causes could be colon, stomach, and lung cancer. If you also feel generally sickly, depressed, or weak, a doctor should investigate the weight loss.
Frequent heartburn. Too much food, alcohol, and stress can cause severe heartburn. Some people generally react to certain foods with heartburn. If you have known this about yourself for a long time, there should be no reason for concern. Nevertheless, try to avoid the triggering foods. Heartburn occurs when rising stomach acid attacks the mucous membrane of the esophagus. It feels like a slight burning pain behind the breastbone. Frequently, heartburn is associated with acid regurgitation. If you notice this as an unusual and, above all, new reaction in yourself, you should first check your diet. If unusual foods were involved, heartburn can be a harmless overreaction. Remove the foods in question from your diet plan and continue to observe yourself. If you have too much stress, then get some rest. In addition, you should avoid stimulants like alcohol, too much coffee, and cigarettes. After 1 or 2 weeks at the latest, the heartburn should have subsided. Heartburn that does not go away or worsens can indicate stomach, throat, or ovarian cancer. In addition, persistent heartburn caused by nutritional errors can sustainably damage the esophagus and lead to what is known as Barrett's esophagus. This disease is considered a precursor to laryngeal cancer.
9. Extreme fatigue and depression. If you feel very tired at the change of seasons, during periods of high stress, due to an infection, or during menopause, that is completely normal. If states of exhaustion last a very long time and increase, then this can be a warning sign. Besides cancer, burnout syndrome and many other illnesses are, of course, possible. It depends on the combination of signals. If you notice further abnormalities, it's better to go to the doctor sooner rather than later. Fatigue and poor performance can be accompanied by depressive moods. Please check carefully if you can explain the frequent sadness, anxiety, or panic attacks. They become concerning when they come out of nowhere and persist over a longer period. Check carefully if a tendency toward depression occurs in your family. Just as thoroughly, you should consider whether there has been a frequent disposition for cancer in your family.
10. Pain of all kinds. Normally, cancer in its early stages causes no pain at all. Precisely this circumstance makes this disease so dangerous. Only with tumors in the head can early pain and visual disturbances occur. Even if a cancer illness is already far advanced, the earlier it is detected, the better the chances of recovery. Therefore, please do not hesitate to go to a doctor immediately in case of unusual, inexplicable, or long-lasting pain in your body. This also applies to long-lasting and painful coughing. After an acute infection, a cough usually subsides within 3 to 4 weeks. If this is not the case for you, you should have yourself examined. If the cough is even bloody, immediate action is required. This could potentially be a sign of lung cancer. If you have now discovered one or another sign of cancer in yourself, you should not panic. Listen to the signs again in peace. Check if there could be other explanations for the signals. Think carefully about your general state of health, your diet, and the life circumstances you are currently in. If an uneasy feeling still remains, then you should by no means hesitate and get certainty soon. Go to your family doctor or a doctor you trust. Describe your observations to them and also mention the connection to a possible cancer illness. We hope you enjoyed this video from Health Elite. Please like and share it, and thank you very much for your supportive comments. We will see you again in the next exciting video.